Okay, now that we've taken a look at some basics about infectious disease, a little bit of terminology, some of the ideas that we think about when we talk about infectious disease, let's return to that idea of infectious disease in our modern society. How is infectious disease impacting populations around the world? Which populations are hit hardest and why? Okay, so let's take a look at this graph for starters. So this graph is showing the leading killers in the year 1900, and it might surprise you to learn that these are the leading killers in the United States of America in 1900. And the top three, pneumonia, tuberculosis, diarrhea, and enteritis, those are all infectious diseases. So a little over 100 years ago, the top killers were infectious disease. And if you notice, you look below diarrhea, and there you see things that are more familiar to us today, like heart disease, stroke, right? Here's liver disease, there's cancer. So that's what it looked like in the United States a little over 100 years ago. Now, if we come forward to today, or today-ish, 1997, and look at what are the leading killers in the United States, all of a sudden the picture has changed. Now it is heart disease, cancer, and stroke as the top three. And looking below that, you see chronic lung disease, injuries. Look, pneumonia and influenza, infectious disease, doesn't come into the picture until 6 diseases down, right? And then there's diabetes, there's HIV, another infectious disease, suicide, chronic liver disease. So clearly in the span of 100 years, things changed dramatically in the United States. And so then the question is, well, how did they change and why? Clearly, these chronic diseases are much more prevalent today than they were. So is it that there's more chronic disease today than there ever was before? Or is it that there's less infectious disease today than there ever was before? Or maybe a combination of the two. So let's look at another piece of data. First of all, let's look at the picture around the world. So I just showed you what the U.S. looks like today. Now let's look at the world today. So same time frame, 1998. Is it the same all around the world if we look at global killers? Well, the answer is no, right? This red slice of the pie here, infectious disease, 25% if we add up all the countries together. 25% of death still due to infectious disease. That's not what's happening in the United States. And if we break it down and we look at low-income African and Asian countries, the percentage raises. The percentage goes up to 45% of the deaths in those countries is due to infectious disease, almost half. And for children under age 5, I mean little kids, 63% of kids in the world who die from infectious disease, right? That's pretty bad. And then if we look at the other killers, cardiovascular disease, yes, that is a big piece of the pie. So is cancer, respiratory and digestive, sort of chronic ailments, right? Injuries. But clearly, globally, infectious disease is still a big part of the puzzle. If we break out countries based on their income, essentially, how much revenue do they make, when we categorize them as more developed and less developed, those terms are problematic. So we'll maybe say resource rich, resource poor, even that doesn't totally work. But again, here's what the U.S. would look like. U.S., Europe, Japan, right? Diseases of the circulatory system, 46%, cancer, 21%, infectious disease, tiny little slice of the pie, 1%. And then here's those other countries like Sub-Saharan Africa, Southeast Asia, where people are poorer in terms of money. 43% of deaths there due to infectious disease. Look at that difference. That is huge, okay? All right, so going back to the U.S. now, I raised this question. What is it? Is it that there's more more chronic diseases today or fewer infectious diseases today? Well, this graph will help you sort that out. So total deaths, this is the same time period, 1900 to 1997. Deaths from all diseases is this light gold, right? And now splitting out that data into non-infectious, into this dark gold, or infectious, the red, if you look here, what do you see, right? Is it that the rates of non-infectious diseases like cancers, have they gone up? No, right? Infectious disease has gone down. So today in the U.S., one way you could say it is that people are living long enough in order to get things like cancer and heart disease. Instead of dying young from an infectious disease, people, because we have gotten such a handle on infectious disease in this country, people are living longer lives. And if you live a longer life, then chronic conditions can catch up with you, right? So this shows you that evidence. So then we can say, well, why? How did we get a handle on infectious disease? What kinds of things can you think of in this country that we do that helps us control infectious disease? Right? Maybe you thought of healthcare. Maybe you thought of antibiotics. Maybe you thought of vaccines. Right? Those are all good things. Those are all excellent things, and they are part of the story. What might surprise you to learn is this part of the story. If you look at from 1900 to about 1940, see that steep drop? This is all pre-antibiotics, pre-vaccines. We didn't start using antibiotics in the general public until the 1940s. We used it in soldiers in World War II and first in the 1940s, right? We didn't get vaccines until the 1960s. So all of this decrease here is due to those advantages. Everything else from 1900 to about 1940, the biggest thing is something we'll call public health. And we're going to talk a lot more about that this quarter. Basically, you have people who are in charge of monitoring the public health and caring for the public health. So things like chlorination of water supplies. Safe water is huge when it comes to infectious disease. Most of those children who die from infectious disease are dying from diarrheal diseases just because they don't have access to clean water. So the fact that we have sanitation systems, we have chlorination, so our water supply is safe. That is enormously beneficial to us. We also pay people, like I said, to track disease, to make recommendations, to figure out what causes disease, and to educate the public about how to keep themselves safe. And we do have access to health care for most people in this country, although not all. So here's that same graph. This time it's labeled with some of the big events. So you can see right here at 1900, by this point, 40 states have state health departments. So they, like I said, they're paying people to do nothing other than try to keep people healthy. And here we have chlorine being used in our water to keep our water supply safe, right? That's helping drive down infectious disease. Take a look at this spike. You might have wondered about that when you saw that on the graph. There was clearly we're getting a handle on infectious disease, and then all of a sudden, whoa, what is that, right? Well, that's the 1918 influenza, which we will also talk about. So if you want to think about a plague in our times, that was one, right? That was a pandemic influenza spread all over the globe, and it was a particularly nasty influenza that killed many more people than we normally see with influenza. Many people think influenza is not such a big deal. I think it's like a cold, but it's not. It's a different virus than cold viruses. And sometimes it's not so bad, although it's worse than a cold, but sometimes it's a killer. And that particular year, it was a very bad strain. It killed, and it didn't even kill. Usually when influenza is bad and it kills people, it kills the really old or the really young. And in that year, it took out the middle. It took out the healthy people, 20s and 30s. Really, really, really a bad year for flu. So that kind of blows the graph out of the water. But then when that pandemic was over, right, we see that infectious disease continues to come down. First use of penicillin here in the 40s. Ooh, we keep getting a better handle on infectious disease, right? Then we get vaccines. Vaccines are taking that down more. We get the Vaccination Assistance Act to help people who are low income get their vaccines. Remember in the 60s, that Surgeon General who said, we've won the war on infectious disease? Yeah, well, look at all this progress. No wonder he thought that. But now here, ooh, what's happening down here, right? We see this little uptick because it's not over yet, right? We're seeing antibiotic-resistant organisms. We're seeing new viruses that we have to deal with. But still, if you live in the United States, in terms of infectious disease, you're much safer here than you would be in other parts of the world. Let's go back to that global picture. Infectious disease is a big killer. Who is it that's doing the killing, right? So let's take a look. So these are the leading 6 killers worldwide. Acute respiratory infections, so that's things like pneumonia and influenza, that's number 1. HIV/AIDS is number 2. Here's that diarrheal disease. And notice the red is over age 5 and the blue is under age 5. So those little kids who are dying, I said diarrhea is a big deal. You can see it right here, right? Lack of access to clean water is killing those kids. That and respiratory infections. TB, number 4, malaria, measles. Okay, so measles is another disease that's misunderstood. Measles causes a rash. Chickenpox causes a rash. Sometimes people think of these as, oh, childhood diseases, they're not so bad. But that's not true for measles. Measles is a killer. Measles has the potential for serious complications from the infection. And you can see it kills a lot of kids. And right now in the United States, we're having some problems with measles coming back because there are people who think, falsely, they think that the MMR vaccine, which is the measles, mumps, rubella vaccine, causes autism, and they're choosing not to vaccinate their children. And we'll talk more about that when we get to vaccines, but that idea has been disproven, but still people believe it, and so we're starting to see more measles outbreaks in the U.S. in populations of unvaccinated children. Here's another picture of those kids under age 5, right? Showing you diarrhea again. Here's pneumonia. And then neonatal, those are newborns, right? So what kills newborns? And here's the list of things that are killing newborns, tetanus, diarrhea, pneumonia, right? But really what I want you to see is this little box here. Undernutrition is an underlying cause of 53% of deaths among children under 5 years of age. Basically, kids that live in poor areas of the world, they don't have enough food to eat. Their bodies aren't strong enough. So when they do get an infection, it's worse than it would be from a kid who was fully nourished. So half the kids who die from infectious disease around the world might not have died if they had a better diet, right? So this is another complicating issue. Right. Here again, another graph showing you the locations of these diseases. So we're seeing communicable diseases are the darkest blue. Non-communicable, so that would be those chronic kinds of diseases, are the medium blue, right? And injuries is the light. And you can totally see high-income countries, again, those communicable diseases, really little. Non-communicable, that's it. And then Africa, oh gosh, look at that, communicable diseases. And also notice the difference between the height of the bars. It's not just what's killing people, it's how many people are dying, right? So many more people are dying in Africa and in Southeast Asia. Here's Southeast Asia, right? And so all high-income countries lumped together. Africa, the Americas, the Mediterranean. You can look at this and see who's dying of what in the world. So if you were to sum it up, right? What's the impact today of infectious disease in resource-rich nations like the United States, right? Do we still have infectious disease? Yes, we do. Do we still have to deal with it? Yes, and there's always something new that's happening. But we have managed to control it here to a much greater extent than other people in other parts of the world, right? How did we prevent it? Sanitation, public health, vaccination, antibiotics, right? What are our areas of concern? Resistant bacteria, new viruses. Right? So what if we look at those resource-poor nations? What's the impact there? Well, you saw in those graphs. It's huge. There's still as many as half the population dying from infectious disease, right? Why? They don't have enough food. They don't have clean water. They don't have access to health care. They don't have antibiotics, vaccines, right? All of these things. So what do we do about this? Well, one of the things you're going to read about this week, when you read the handout that I posted on Canvas, that is an introduction to global issues, you are going to read about the iceberg model and systems level solutions. So when you have a problem and you want to think about targeting that problem and solving that problem, do you do the quick and easy thing, or do you look for the fundamental causes and try and treat it from the bottom? And so